There are a lot of reasons why I use the Sophi machine. First of all, as you can see, the footprint is very small. In relation to other phaco machines from other companies with a very big footprint, when you're working in the OR, you want a slim machine not taking a lot of space. On top of that, there are no cables. The foot pedal is without cables. It is with Wi-Fi, Bluetooth is also enabled. There are two different versions. One is peristaltic only, and the other one is peristaltic and Venturi. I was always to use Venturi since 1997. But when the Sophi was introduced to me 3 years ago, I began to like more and more the peristaltic pump as well. So you know, Venturi is you get vacuum always. With peristaltic pump, you only get your vacuum when you get occlusion. And the third pump, which is a peristaltic pump, is to give active pressure, so you have a very stable anterior chamber. The graphic user interface, it's very easy to use. I can do it with my foot pedal, but also I like to give instructions to my nurse saying, okay, raise the bottle or lower the bottle when you are in myopic cases. We do a lot of post-archaic cases, post-LASIK. We want to have the bottle lower, so it's very easy. We have a sterile drape here, so the nurse can just put and dial down the bottle height to have less infusion in those myopic eyes. As you can see, you have a menu on top of the screen. When I have a hard cataract, I like to chop. And maybe, Benjamin, if you can show, this is an example of a hard cataract chopping, holding the lens with that 500 millimeters of mercury. This was a flex case, so it's a little bit pre-chopped, of course, but it's just showing you how easy it is to get that piece really onto your phaco tip, and it's easy to chop even those hard cataracts. In those cases, you have a very stable anterior chamber. When I'm explaining to you also the foot pedal, it's a dual linear foot pedal. So when pushed down, you get irrigation, step 1. Step 2, when you push further down, it's aspiration. And then sideways, I get my phaco power, and it's linear. So when you have a softer cataract, you can have less phaco power. When you have a harder cataract, you go more sideways, so you have a harder phaco power. You can see this here as well, here. So this is the foot pedal program. When I go to the left, it's reflux. When I go down, I set it's the irrigation, linear aspiration, and then sideways is my linear phaco power. And these buttons, you can program them all as well. For me, this is power up, and actually those two, the low ones, I do not use. And this one is for me also the higher bottle height, so higher IOP. We all know when you are treating phaco with a small pupil, the iris tends to move a bit. And here, because of the so stable anterior chamber, removing those lens fragments, you do not see the dancing of the iris, not at all. The pupil stays nicely in that semi-mydriasis without having that iris coming to your tip because of the dancing around. So the stability of the anterior chamber is of utmost importance when dealing with those cases. So when we go to the second step in hard cataracts, which is called the segment removal, I also have a video, if you can show the third video, then about the segment removal. Remember, this is 600 millimeters of mercury. Again, the followability is very nice. I even removed my second instrument, and you can see that the pieces are coming very nicely to the phaco tip, while remaining of maintaining a very nice anterior chamber. My preference is a bimanual IA technique. I want to take out the pieces one by one, taking great care of removing all the cortex remnants. And so this is actually the IA already, so this is the next step. Again, you can do it with your the black knobs here, or you can ask just the nurse to tap it and it immediately moves to the next step. It's set at 32 milliliters per minute, the vacuum 400 millimeters of mercury, and an active infusion of 75 millimeters of mercury. So this is again a bimanual removal of the cortical remnants, and then when those remnants are removed, we go to the polish mode. The peristaltic flow is set very low, 8 millimeters per minute. The vacuum 60 millimeters, and the active IOP 70. And you will see that I can just scrub the posterior capsule, and it goes into the opening of the aspiration port, but without breaking it. It's very gentle. You can do it without breaking the capsule, but you have to make sure that your settings are really low. That's very important. And then, of course, the IOL is introduced. And then I have another setting for my visco removal, because I want to remove it to the main incision. That's why my flow is back to 30 milliliters per minute, the vacuum of 400, because it's a larger aspiration port, and an active IOP infusion of 75 millimeters of mercury. So, and then of course you have also the vitrectomy settings, which I don't want to see during my surgery, as you know, but still sometimes it happens and you need it. The cut rate, I set it to 2,000 cuts per minute. The peristaltic flow 30, the vacuum 300. Again, you can do it linear with your foot pedal, so it's only the maximum. And as you know, when you do a vitrectomy, don't use a lot of vacuum, and an active IOP infusion of 60 millimeters of mercury. So this is my settings for a hard cataract. As you could see, it were all peristaltic settings, because I want to be gentle going here, not being too aggressive. But when I'm treating softer cataracts, medium to soft cataracts, then I'm a little bit more aggressive, because I want to have a fast surgery. So as you can see, the flow 30, that's typical 30, 35, 36. The vacuum is low, because I want to make, when you have a soft cataract, you want to make a groove or maybe a trench, and then you hold that softer cataract. You need a lower vacuum, otherwise you suck through it and you lose your grip on your lens. So you can put it at 35 millimeters of mercury, and the infusion is 70 millimeters. The segment removal is here. The others are the same. For irrigation aspiration, I go back to my peristaltic pump. So I use in these settings a mix of Venturi and peristaltic pump. The Venturi is actually for the segment removal because it's very fast. And to do the cortical cleanup, I switch to the peristaltic to have a softer approach to removal of the cord, because it goes very fast without a lot of capturing the capsule when doing. The polish and the visco are actually the same as with my hard cataract settings. So as you can see, this instrument is versatile. It has a small footprint in the OR. There are no cables, so I do most of the time an immediate sequential bilateral lens surgery. And I do a temporal approach. So I move from the temporal side to the other side of the patient immediately. It's easy to, you can unlock the foot pedal. My people can just turn the Phaco pedal when I'm moving to the other side. So it goes very fluent, no cables or no entangling of cables going on. So it's very, very efficient working like that. Another thing, there's a lot of talk about sustainability. We all talk about, sustainability, and it's good for the environment, and we have to drop our waste. So this one is a day cassette. We do 10 cases with the same cassette. There are inbuilt security systems, of course, that you do not cross-contaminate between eyes. The tubings are changed, but not the cassette. So at the end of the day, I'm doing typically 25 to 30 cases in a day, so I only have 3 cassettes, which I'm throwing away instead of 30. It's much more cost effective. It's good for the environment. And again, if you have any questions about being sterile, working sterile, I'm using this system for 3 years now, and I have 0 cases of endophthalmitis, and we do like 1,500 cases a year. So of course, the incidence of endophthalmitis is of course very low nowadays. It's 0.035 according to the ESCRS study, which was performed like 15 years ago. But still, it proves that after 3 years using it in more than 4,000 cases, we had not a single case of TAS, not a single case of endophthalmitis, meaning that this system really is reliable in terms of delivering a sterile environment when doing your lens surgery or cataract surgery in general. This is a bird's eye view of this instrument. Thank you very much. Thank you.